Hey guys, John Schumacher here with NewWaveHealthcare.com, and today my guest is Akhsar Kharebov, the CEO and founder of Infometers, a remote monitoring health company. And he's come on the show today to talk a bit about his business and share a bit about remote monitoring. So, Akhsar, hey, thanks for coming on the show today. Let's just have you start off and just simply tell us about your business.
All right, thanks, John. Pleasure to be here. Thanks a lot for inviting me to your show. So Infometers is working on a remote patient monitoring platform that serves as the interoperability solution for multiple medical devices patients use today at home to monitor the most common chronic conditions like diabetes, hypertension, obesity, heart failure. And we provide our service for other health organizations that are trying to manage population of patients and decrease costs and save lives.
Right, absolutely. So, and you guys handle all the major diseases like diabetes, heart, blood pressure, obesity, metrics, everything like that?
Yeah, so most of the chronic conditions have some overlapping metrics, and so diabetes, hypertension, heart failure, high cholesterol, obesity, similar data points are interesting for all of those conditions. And so you're looking at blood pressure, oxygenation, heart rate, blood sugar for diabetes, cholesterol levels for hypertension, cholesterol. For asthma, you might be looking at lung function, for example. And we support a broad range of devices that sort of represent each of the categories.
Okay. And do you guys personally sell these devices, or do you just simply provide the means for the current devices on the market to connect with a mobile device or something like that?
Yeah, thanks. We don't sell, we don't make our own devices, really. We're not a device manufacturer. We're sort of friendly to all the device guys, and we'd love to work with any of the companies that make their own devices that want to enable them and integrate them into the healthcare system. We make software, and sometimes we end up packaging devices with our software, but that's primarily to enable our customers to quickly launch services to their patients.
Right. So you guys you're in the software business. You guys aren't in the hardware business. You guys are basically. Are you guys on like Android? Are you on Apple? iOS? Like what are you guys on?
So currently we have an Android app that we have had for about a year, and it's a very simple demo of our core technology. In a couple of weeks, we'll have a new product release. There will be an end-to-end solution for patient monitoring that will be available on Android, iOS, and Windows PC Store.
All right, sounds good. So tell us a little bit about your personal background. I mean, have you been in healthcare a long time? Were you in the technology fields? Like, what's your background?
So I started out working in mobile about 8 years ago, and originally I built a mobile social network and eventually sold it to another startup. And from there, I sort of learned a lot of the skill sets and I've gotten a few ideas of how you can take old school technologies, apply mobile or web technologies to it, and then sort of change some of the metrics, some of the sort of internal gears, so that you can have a more favorable return on your investment. So this is similar to what we see people do with infrastructure and other software products. We're doing something similar as well, where we're building out a solution that other companies can use to launch end patient services. And it's something that I've seen many times over. You see sort of GitHub providing it for code, Amazon service providing it for cloud storage, Dropbox providing it for file storage, and all of that experience has sort of led me to see an opportunity in the healthcare market with sort of device interoperability and creating an infrastructure that can solve that problem for everybody else.
Right. Yeah, and healthcare is in big need of something like that. I mean, there's so many chronic diseases that need, solid, monitoring, and it's just not a great way to do that right now. And, what your company is looking to do and is connect the person who needs that monitoring to their health professional digitally, through some really neat devices that are out these days. And I think that's just huge because as you know, I think what is it, 75%. What's the statistics on chronic disease? 75% of all patients are basically chronic disease patients, and you just
Spending
have,
wise, yeah, yeah. Maybe statistically speaking, maybe not. We do have a lot of people visiting doctor. Like maybe twice a year, me and you visit doctor, but money spent wise, it's a very small percentage of patients that, well, not small, but a small percentage of patients that actually have chronic conditions. And the reason for that is that the current situation, the current solution is not very well designed to sort of handle all of them coming through the door.
okay.
Yeah,
So,
yeah.
so boil it down for us. Boil it down to us to like a really simple statement. And if someone came up to you and said, "What does Infometers do? What key problem do you guys solve?" In your own words, go ahead and tell us what that is.
Right, so we solve the medical device interoperability problem, which, based on a recent study by the West Health Institute, is shown to be a $30 billion a year problem in just integration costs alone, and additionally, a even higher problem in sort of opportunity loss in terms of preventing chronic care complications and things like that. And so our company is trying to make it easy for people to get data from patient monitoring devices.
All right. Sounds good. So what sets your company apart from other companies? Because there's other companies out there that are doing remote monitoring, like what is it, SITA or Qualcomm Life, excuse me, other larger companies that are providing remote monitoring capabilities. Why would someone want to work with with Infometers versus those companies?
So that's a great question. A lot of the existing solutions are piggybacking off standalone custom hardware that is really expensive to deploy in mass numbers. And so to monitor patients for those solutions, you have to purchase, $1,000 worth of equipment per patient. In our case, we work from PCs or smartphones people have today, and other people that are a little bit more forward-thinking build proprietary systems that really are not flexible for working with startups and working in a health innovation ecosystem. We offer something that's very flexible, very agnostic, and very friendly strategically to other companies in our space. And we feel that that makes it a really good option for these companies.
And what about the cost comparison? I mean, is there a cost difference there between you guys?
Yeah, and our services are 10 times cheaper. But more importantly, I think, is the strategic aspect of things. Large companies are interested in controlling the entire ecosystem. And so one of the biggest fears that startups have when they're working with somebody that large is that will these people end up competing with me on my vertical? I'm using their infrastructure right now, but since they're selling services across many verticals, including my own vertical, will I in the future be competing against their portfolio of services? And that's a issue you run into when you're working with large companies going after control of the ecosystem and stuff like that. In our case, you could be sure that we're not competing with you on your vertical of providing patient management services, providing analytics, providing billing, providing HIPAA-compliant storage, what have you, because we're just providing device integration. We're a small company that's laser focused on that.
Right. So you guys are a little more niche, a little bit less
Yeah.
costly, more focused on that particular aspect. So boil it down for us. Like, why are you guys different in like a couple statements?
Right. We provide a solution that's all software that works on multiple platforms, PC and mobile, and that connects legacy wired and wireless devices. Strategically speaking, we're agnostic and we're non-competitive with other companies in our space who are pursuing other verticals like patient management or analytics, and we're also 10 times cheaper.
Gotcha. Perfect. Well said there. That's perfect. Put it in a succinct manner. I like that. Um, Tell us about your business model. Like, how do you guys make money?
I mean, never to make money. We charge per patient, and we have a very straightforward model where we charge 99 cents per patient per month. And essentially, for those 99 cents, you can monitor your patients across multiple platforms and across multiple devices.
Perfect. And so, yeah. And let's see. One other thing here. So this last question here, I want you to really kind of, put it out there for us today. Is tell us something you guys are really excited about at Infometers. Like, what's something that's new that's coming from you guys that you want to talk about here today?
Sure. So in a couple of weeks, we'll have a turnkey solution that will allow anyone across the world to launch remote patient monitoring services by just signing up with Infometers. And essentially, this solution will include mobile and PC applications, devices that you can freely purchase on Amazon or at your local stores, and a website where you'll be able to view patient data and communicate with the patients. And so it's a very simple turnkey solution that provides sort of end-to-end patient monitoring. It doesn't replace your EHR and things like that, but it does allow you to really quickly start sort of monitoring your patients remotely and catching the complications if you'd like to.
All right, sounds good, man. So let's just this is the last question here. So let's just have you, as we part here, tell us anything else you'd like to share about your company, and then share the best place for us to get a hold of you and learn more about you, and then we'll wrap things up.
Yeah, so Infometers is located in Mountain View, California, and we are a small team of about 10 individuals. We're currently looking for additional opportunities in terms of clients. So if you are interested in remote patient monitoring and you're wondering how to enable that for your clinic, for your hospital, for your elderly care center, for your health IT startup, please speak with us. Please go to infometers.com or send me an email at akhsar@infometers.com, and get in touch with me, and I'd love to sort of help you out and work with you.
Perfect. All right, my friend. Well, thanks so much for coming on and sharing your story. And if you guys are listening to this on iTunes or Stitcher Radio, we'll have a page put up probably in the next couple days that'll be, you can go to newwavehealthcare.com/Infometers. You can watch this interview live video. We'll have links to Akhsar's websites and information on there as well. Or you can simply go to newwavehealthcare.com, scroll down to the find an interview search bar, and just enter Infometers, and this show notes page will pop right up. So I hope you guys enjoyed that. I'll have another live interview next Monday, the 17th at 4 p.m. Pacific, 7 Eastern. So I will see you guys then.